Hi, welcome back. Parents are very concerned about the recurrent infections that their children are having. These are coughs, colds, fever, vomiting, diarrhea. These are happening again and again. They are very frequent. Sometimes they look as if they are happening back to back. One finishes, the other starts within a few days. They are sometimes too long and they don't seem to respond to the normal medications that they used to have. So there are four scenarios that I can explain. One is that it's a normal child who is having more than the normal number of infections. The second is a child with chronic disorders of the heart, lung, or the intestines. I think most parents would be already aware of these problems and they would anticipate infections, or the doctor might have told them about it. The third one is a child with allergies of the nose, throat, etc. But usually allergic symptoms present slightly different from infections, though infections are more common in allergic children also. The fourth one is a child with immune deficiency. I think this is the one that parents are really keen to exclude. So in this video, I'll explain to you about the normal child, because that is what we are encountering mostly. Almost all children are normal, but they are having an excess number of infections, unfortunately. And towards the end, I'll talk about the immune deficient child and how do we evaluate. Now, the process of evaluation is usually almost always based on the story, history as we call it. So, history of past infections. And we add a physical examination of the child and we use very little of laboratory tests. This is for screening an immune deficiency. But if suppose somebody really has an immune deficiency or suspected it, then we do more elaborate testing. But for screening, we don't use that much of blood testing. First, I'll talk about the normal child. It is well known that normal children can have anywhere between 4 to 8 infections every year. And each of these infections can be lasting from 7 to 10 days or even 14 days. So collectively, it might be 80 to 100 days or even more of infections in these children. And it might look like as if it is not improving at all. It is going on and on and on. But in between these infections, if the child becomes completely normal and recovers very quickly, then that is a good sign. Again, it also depends upon if the child goes to play school or mixes with other children, because then they are at risk for getting infection from other children, which happens normally, and then they bring it home. If the child is living more secluded life, not mingling with other children, then they might have less number of infections, maybe 2 or 3 in a year. Both these are normal. Now, infections means ear infections, throat infections, maybe an occasional pneumonia. These are the ones we are talking about. Maybe occasional vomiting, diarrhea, or fevers. If a child up to the age of 3 to 5 has had a couple of ear infections, maybe 1 or 2 pneumonias which are not complicated, growing and developing normally, and has managed to overcome these infections without any antibiotics or maybe just oral antibiotics, then that is a very good sign. So we should be confident that the child does not have any major immune problems. Now, coming to the evaluation of an immune deficient child, there are two types. One is congenital, the other is acquired. One is the child is born with an immune deficiency, it means there is a genetic defect. The other is a child who is born normally with normal immune system, but because of various circumstances develops an immune deficiency. Now, this is called secondary. This first, to take up the secondary one, it could be because of severe malnutrition, it could be due to burns, it could be due to HIV infection, or it could be due to various medications like cancer treatment or steroids, high dose steroids. So it's easier to know if a child is immune deficient if they are having these conditions, and it's self-evident. It's more difficult to try and find out the congenital immune deficiency. Sometimes, very rarely, some children might have repeated ear infections or repeated pneumonias. Then what we try to do is to see if there is any local problem that is giving rise to these infections and not immune deficiency. Like suppose if there are recurrent pneumonias involving one lung, we try to see if the child has swallowed a peanut or a plastic toy. Or if it is recurrent ear infections, we try to see if there is any anatomic problem. If these are not there, then we go ahead and try to rule out an immune deficiency. So when we are trying to evaluate a child for immune deficiency, what we do, or what I personally do, is that try and see if there is any secondary factors which could lead to the immune deficiency, like the factors I mentioned just a minute ago. If they are not there and the child is otherwise well, then we try and see if there could be any suggestions of immune deficiency in the child. How do we do that? We again go back to the history and see the number of infections the child has had. There is a Jeffrey Model Foundation in USA who have made a list of 10 So the bottom line is that if your child is growing, developing normally and has had an occasional infection from which he has recovered well, he or she, then there is nothing to worry about. Again, some parents are very keen to find out if they can give some immune boosting medications to this child, like in the form of multivitamin pills or syrups, etc. In our system of medicine, that is the Western system of medicine, we don't have this concept of immune boosting. So there is no use popping in these pills and syrups. I think a normal, regular diet is absolutely fine. Thank you.